During a tense Senate hearing, Senator John Kennedy questioned the Secretary of Health and Human Services about workforce reductions, federal spending, and oversight of taxpayer-funded programs. Senator Kennedy opened by asking how many employees were working at HHS when the Secretary took office.
Senator Kennedy.
Mr. Secretary, how many employees were there at HHS when you took over?
82,000.
How many do you have today?
62,000.
Okay.
It's about the level it was in 2019, right before COVID.
Is this the first time that an institution in America has ever downsized?
I don't think so. I think private and public institutions have
Microsoft just announced that they were going to reduce their workforce by 6,000 people. You think that'll be the end of Microsoft?
Senator, we wouldn't have reduced anybody.
You think that'll be the end of Microsoft?
I don't think so, Senator.
Meta, I still call them Facebook, just announced they're going to reduce their workforce by 3,000 people. You think that'll be the end of Meta?
I imagine it will not.
Yeah. Think maybe the people at Meta know what they're doing?
I think that they do. They make a lot of money, Senator.
Do you hate NIH?
I love NIH. I grew up with NIH. I visited when I was a boy. I loved science, and those were my favorite afternoons, visiting the labs.
Do you hate medical research?
No, I think we need to lead the world in medical research in this country.
In fact, isn't it true, Mr. Secretary, that you would like to see more money spent on medical research?
Obviously, I'm the secretary of this department. No secretary wants to see his budget cut.
Well, one way of doing that, it seems to me, would be to stop some of the stealing. And let me tell you what I mean by that. Let's suppose you give NIH gives a university $100 million to research, for medical research, to research a cure. And that university takes 30 million of it, doesn't spend it on the research. They use it to subsidize the rest of their university. Does that show a commitment to medical research?
No, and I mentioned before the example of Stanford, which was taking 78% in indirect costs, and we don't know what they were spending.
That's theft, isn't it?
It's not a good
in Louisiana,
way to spend
we call
federal
that stealing.
Taxpayer dollars.
We call that stealing. Is there any doubt in your mind that a lot of universities are taking this NIH money, which is supposed to be spent on medical research, and using it to fund other parts of their university? Is there any doubt in your mind, Bobby?
Oh, and Senator, the other people who are writing grants, like the Gates Foundation, the Rockefeller Foundation, they pay 10% to 15% in indirect costs. We were paying 50, 60, 70%.
So, in fact, what you're doing is adding money to medical research.
We will be able to fund many, many, many more studies by eliminating that $9 billion, at least part of that $9 billion cost.
Okay. I want to ask you about LAHEAP. Are you familiar with this GAO report they did on LAHEAP?
I am not, Senator.
They found, they audited 7 states. They found 11,000 dead people getting LAHEAP grants. You familiar with that?
No, but that is pretty typical of many of the other programs that we're working with.
They found prisoners getting grants, didn't they? Were they using the grants to heat their jail cell? They found 1,000 federal employees getting the grants with federal salaries that greatly exceeded the income limits. They found some of those folks living in million-dollar homes. I got 18 seconds. Why do we allow highly processed foods in America?
That's a complicated question, but it's driven by profits, but to a food industry that is making money by poisoning American kids, and they don't do it abroad. They make the same products for Canada and for Europe that do not contain many of those chemicals.
You understand, Mr. Secretary, there's nothing you can do that's going to make many of my Democratic colleagues happy. You get that, don't you?
I do understand. I'm coming to understand that, Senator.
Yes. Thank you.
Senator Murray, welcome. Nice to see you, and I'll turn it over to you for questions.
Thank you very much, Chair Capito. Senator Baldwin, I look forward
The
to working with you both.
Secretary responded that the department had approximately 82,000 employees at the time. Kennedy then asked how many remain today. The Secretary replied that the current number is about 62,000, roughly the same staffing level as in 2019, before the COVID-19 pandemic. Kennedy challenged the idea that downsizing was unusual, noting that both public and private institutions regularly reduce staff. He pointed to recent workforce cuts announced by major companies such as Microsoft and Meta, formerly Facebook, and questioned whether those companies would collapse as a result. The Secretary agreed they would not and acknowledged that such companies likely know how to manage their operations. The Senator then shifted the focus to medical research, asking whether the Secretary opposed the National Institutes of Health or medical research more broadly. The Secretary strongly rejected that suggestion, saying he loves NIH, values science, and believes the United States must lead the world in medical research. He also acknowledged that, like any department head, he would prefer to see increased funding rather than budget cuts. Kennedy argued that one way to increase funding for research would be to prevent what he described as misuse of NIH grant money. He gave an example of universities receiving large research grants but diverting a significant portion, sometimes tens of millions of dollars, to subsidize other parts of their institutions instead of direct research. He cited past concerns over high indirect costs charged by universities, calling the practice unfair to taxpayers. The Secretary responded that other major grant-making organizations, such as the Gates and Rockefeller Foundations, typically allow only 10 to 15% in indirect costs, while NIH grants have sometimes covered 50 to 70%. He said reducing those costs could free up billions of dollars and allow funding for many more research studies. Kennedy then raised concerns about fraud and waste in federal assistance programs, referencing a Government Accountability Office audit that found thousands of ineligible recipients receiving energy assistance grants. The report identified payments going to deceased individuals, prisoners, and even federal employees whose salaries exceeded income limits, some of whom reportedly lived in million-dollar homes. As time expired, Kennedy briefly asked about the prevalence of highly processed foods in the United States. The Secretary responded that the issue is driven largely by profit motives within the food industry, arguing that American children are exposed to chemicals that are not allowed in similar products sold in Canada and Europe. The exchange ended with Kennedy remarking that the Secretary's reform efforts were unlikely to satisfy many Democrats, a point the Secretary acknowledged. The hearing then moved on to questions from other senators.